Happy Thursday, everyone. This is our live session, Ask Dr. Jeff. Um, like every Thursday, we meet with Dr. Jeff. I'm just waiting for him to join. There. Hi, everyone. This is our live session, Ask Dr. Jeff. So get ready for the questions. We have also some of the questions that you sent through Instagram, and there he is. Okay. There he is. Huh. We're having some there he is. Doctor, how are you?
Good to see you.
Good to see you. Happy Thursday.
Happy Thursday.
Awesome. So, Doctor, I'm gonna start right away with some of the questions that we
Sure.
have. V Sandra 06. I had a lipo 360 with BBL, and I would like more fuller plus breast augmentation.
So let's do it. All right. So the question is, where are we starting, right? And and how full does she want to be? It sounds like she wants to be pretty full, and that's important because you want to balance, right, the position and the fullness of the breast with the BBL. So it really all has to be harmonious. So that's not a problem at all.
Okay, beautiful. And we have drive my legs. I just sent my pictures over. Okay.
All right.
Beautiful. Doctor, if it's for Dr. Jeff, he's going to be checking them. I just want liposuction, she said. The real PBX. Hi, Jeff. Little hearts.
Oh, nice.
I'll see you in March 3rd.
All right. I'll be here.
What else we have here? What are some do's and do nots pre-tummy tuck surgery?
That's a great
And that's
question.
from Limaya.
That's a great question. So things you shouldn't do: don't gain weight, don't smoke, don't use bad
Mm.
substances,
Oh,
right? Things that can cause
yes.
problems. Be very careful with supplements because supplements can cause bleeding. All right. So a lot of these things, ginkgo biloba, stuff like that. These things are good normally because they thin the blood,
Mm,
right? So less stressful for the heart. So that's always a good thing. But right around the time of surgery, they cause bleeding. All right. So we want to
mhm,
avoid many of these supplements unless we specifically have discussed them with you. All right. And the things that you should do is keep an eye on your diet. Right. Some
mhm,
patients have lower hemoglobins. We might want to do a few things like taking iron or even occasionally iron infusions to raise the hemoglobin. Some patients are doing combination procedures, and we're only going to do those if, there are no medical, issues in doing those procedures. Right. So,
mhm,
in addition to where somebody's starting physically, the question is, where are they also starting medically? All right. Do they
mhm,
take any major medications? Do they have any medical issues? All
mm.
these things come into play in deciding what to do. So that's a great question. If you have anything more specific for me, I'd be happy to address.
Yeah, Drive My Leg says, yeah, I'm so excited. And
Good.
and she's asking, I had a C-section, so would I have to get a tummy tuck or I can get lipo?
Well, it depends. All right. It
Yes.
depends. I mean, so the answer to that would be yes. All right. You may need a tummy tuck or you may need lipo. So every one of my tummy tucks includes liposuction, right? Of the love handle, the flank area, and the upper abdomen. Okay. But do you need the tummy tuck? Well,
Mhm,
you might need it if there's redundant extra skin, then you would need it. So if you send us photos, I could tell you pretty easily if you would need the procedure or not need it. But
mhm,
there are many people who have had a bunch of kids that only need liposuction, and there are many who have had no children who need a tummy tuck. All right, so it really depends on what on what you look like and what the excess skin situation is. So send us the photos or come in. We can talk in person anytime.
absolutely. And girl from 181, after a tummy tuck, got a small ventral hernia. Is it possible to get another tummy tuck?
Oh, of course. Again, it depends on what the situation is. Was the muscle repaired? Why did they develop a ventral hernia? Is it an umbilical hernia, or is it a separation of the muscle that potentially had been repaired? If it wasn't
Mhm,
repaired, I've never seen the muscle separation occur following repair. Knock on wood here. So
mm,
I've never had that happen. It usually should not.
mhm. Yeah.
Some people use dissolving stitches. Bad idea. I always use a very specific stitch that does not resorb, and
Mhm,
I've never had that issue, but it occurs. Anything is possible,
mm,
certainly. So
mhm,
Send us photos, come in, let's take a look at it. But the only way to repair a ventral hernia would be to open things up again. Can you do another tummy tuck? If there's enough skin that's still excessive, we absolutely can do that. If there's not quite enough skin, then what we might end up with is removing the skin that is there. But we might also have a small, like a 1 inch vertical incision where the belly button used to live. Not a big deal.
Shakira, Shakira. See you in a week, Dr. Jeff and Blue
All right.
Hearts.
So Shakira's coming in. Wonderful. We'll see you in a week. I'll be here.
And Brown Skin Brownie can't wait to come get my tummy tuck.
All right. Good, good.
And any recommendations? This is from Judge Dan. Okay. Any recommendations for higher BMIs?
For high
That's
BMIs,
that's a very good question.
that's a very good question. So my cutoff typically is about 38.
Hmm.
All right. If we're beyond 38, then I would work on losing weight to bring that weight down below 38. And it really is a
Hmm.
safety factor. It's really
Hmm.
twofold. It's both an aesthetic factor, meaning, the what we can do to improve the cosmetic result, the aesthetic result, number one. But number two, more importantly, is all about safety. Okay. So if we're doing, a BBL, we're turning somebody face down, that could be a real anesthesia risk. Even with a tummy tuck where somebody's, on their back, still, if we have excessive weight, you're still pushing against the abdominal wall, which is increasing the pressure inside the chest where the lungs live. And that's also problematic potentially for our anesthesia team and for you. So for
Yes.
high BMIs, let's bring the weight down. If it takes a few more
Hmm.
months, I'm not going anywhere. Let's bring the weight down to below 38 and go from there. That's a great question.
I also like what you said, doctor, because even though 38 and 39 is kind of like a high BMI, like they need a plan sometimes. Like they might not expect to be super skinny when with the first surgery. When you have a high
Well,
BMI
that's
like that,
great.
you might need another surgery
That's a great point you make, Lily. And what she's talking about really is we have to have realistic expectations also. Okay, so
after.
people come in, and if somebody weighs 240 pounds, you're not going to leave weighing 120. All right, so we're not doing that type of surgery, and that would never be safe anyway. And patients ask, how much weight will I lose with a tummy tuck? And that's a valid question. And some patients we remove even as much as 15 or 20 pounds, and other
That's
patients
true. I've
typically
seen it.
3 pounds. You've seen it. 3 pounds,
Hmm.
5 pounds. I think you've seen some of my posts here where we've removed 18 or 20 pounds. That's dramatic. All right.
Hmm.
But the point is that a tummy tuck and no surgery I do is a form of weight loss. You may lose
Hmm.
some weight, but the only
Hmm.
real form of weight loss is actually weight loss, is actually,
Hmm. Hmm.
whether you're taking a medication to help you lose weight, like the GLPs, or whether you're doing a sleeve procedure, or whether you're just doing good dieting and exercising. All these different methods are there for one purpose, which is reducing weight, and as a result of that, improving your candidacy, improving um, you know your chance of having a great outcome following surgery. So we take that very seriously. So
Beautiful.
that's a great question. But preparation, lose weight beforehand. Losing weight may cause more skin excess. That's okay because we're going after that.
And nowadays, doctor, you as a doctor, with all this that you mentioned, GLPs and Manjaro and all that stuff, it's easier for people to actually achieve that goal, right?
It's become a lot easier, and now they're actually putting out GLPs that are oral instead of the shots. So those
Mm,
are entering the market. It'll be easier and easier. Of course, you have to
mm,
do this under your
wow.
doctor's supervision. So, they're not going to be over the counter, and they should not be over the counter. But for people who qualify, there are a number of criteria, and we need your doctor, your PCP, or your gynecologist, endocrinologist, whoever the case might be, to oversee this. And I work with these doctors to make sure that you're doing this safely. And when you've reached, a goal weight, we can then go ahead with the surgery. But yeah, Lily, you made a point before 38, 39. These are not small. All right. So
Hmm.
these are high BMIs. All
Hmm.
right.
Hmm.
And that's why we cut we cut it at that point, because we're not going to go into 42 and 45. And those are just, dangerous. All right. So we're
Hmm.
not, if you were my relative, this is what I would tell you. And I mean that.
Absolutely.
So I would not do this procedure on my relative if they had a BMI of 42 or 44, that sort of thing. And 38, 39, I'm going to take a close look, make sure that there are no major issues, diabetes, high blood pressure, things like that. And again, we operate on patients, all day long that do have medical conditions. All right. But
Correct.
are they controlled? Are they being, managed by a cardiologist, by a PCP? Who's managing this?
Mm.
And how successful are they? By an endocrinologist, is the A1C well controlled? So depending on the medical status, we can do surgery on a whole host of different conditions. And patients ask me all
Mm-hmm.
the time, our coordinators come in and say, hey doc, can we operate on somebody who has alpha thalassemia? And the short answer is yes, of course.
Mm.
And we do that. But the bigger answer, which they already know, is we're going to need medical clearance. We're going to need to make sure that it's controlled. And we need to
Beautiful.
make sure that there is not going to be any issue
Exactly.
following this procedure. Of course, because safety is always
Yes.
going to be our priority, 100%.
Awesome. And from Regan, when is it cell saver required?
No, that's a great question. Okay, so sometimes we're doing, say, a
And
combination
doctor,
procedure.
and I'm
Yep,
sorry to interrupt,
sure, sure,
but can you also explain, because I know a lot of people, they might not know what is cell saver. So like a brief.
sure. So Cell Saver is a medical device, okay, that is attached to a patient through an IV. And basically, the blood's collected typically during a liposuction procedure, which is collected sterilely, of course.
Mm-hmm.
Liposuction, BBL, those are the best procedures to collect during. So that fluid that we collect through the suction system that goes into the machine is filtered and washed and basically, consolidated. So we don't need the excess fluid. We just want the blood volume, the packed cells. Okay,
Mm-hmm.
that is then reprocessed back into a like an IV bag that's then given back to the patient. So the chance of getting the wrong blood is zero because it's all your
It's
blood,
your own
right?
blood. Yeah.
So
It's like
the
it's like a
chance of
transfusion of your own blood.
well, technically, it's called an auto transfusion. That's exactly
Oh,
right. So it's an
oh wow.
auto transfusion of your own blood. You're halfway there,
Mm-hmm.
Lily. So it's an auto transfusion. It's extremely safe. And do we do that every day? Well, no, because most patients don't need that. But if somebody is borderline, and we have a number of patients who have been trying hard to push that hemoglobin up, push it up the hill from say,
Mm.
11 to
Mm-hmm.
12.5,
Mm-hmm.
or 12 to 13, depending on where we want to be based on
Mm.
the procedure or the combination of procedures that they
Mm-hmm.
want to have. Okay.
Mm-hmm.
So if we find they're just about there, but not quite, we can either not do the combination or in some
Mm.
cases not do any procedure. Even single procedures may be deemed, inappropriate
Mm-hmm.
if the hemoglobin is 10.5 or even 11. So in those cases, we may want to do it in combination with a cell saver where we
Mm-hmm.
feel there's no room for any further blood loss and we want to recycle that blood and do the auto transfusion. So that's a great question.
Inkilicious says, Dr. Jeff, I hope to be your patient sometime this year. And she puts like
All right.
that kind of
Great.
face.
I hope to have you as my patient sometime this year. I look forward to that.
Daughter of Yemaya, my BMI is 30. Is that good? Or and how much I lose doing a lipo 360?
So 30 is great.
Mm-hmm.
Okay, so 30 is not a problem. Don't go away. I'll be
Mm-hmm.
right back.
Mm-hmm.
Sometimes I talk too much and
Mm-hmm.
I just need, I'm just getting dry in this place. Just need a
Mm-hmm.
drink.
Perfect. Doctor, and also she's asking how much she's
30 is
gonna
great.
lose.
No, I heard you. So how much you're going to lose? I think you're only going to lose your concern that you were too full. You're only going to lose your self-consciousness. But as far as weight, well, that really depends. And I said a few minutes ago, patients ask how much I'm going to lose with a tummy tuck.
Mhm,
So with pure liposuction, typically the limit is 4 liters of
mhm,
fluid that can be removed, right? So that's
mhm,
basically 4,000 cc's. All right.
mhm,
So that weighs around 6 to 8 pounds. All right. But
mm. Oh
typically
wow,
some of
I
that is
didn't
the
know that.
well, typically, yeah, that's what a gallon is. It's like 8 pounds. All right. But the
Ah,
bottom line is when we do liposuction, we're also removing the fluid that we've injected. All right. So with liposuction, you may lose a couple pounds. All right. But liposuction is just completely not a form of weight loss. All right. You're not doing
exactly.
liposuction to
To
lose
lose
weight.
weight.
So you don't even have to worry about that. That's why I say you're going to lose your self-consciousness. All right. You're going to lose feeling bad in clothes. You're going to lose more money because you have to buy smaller clothes. Right. So stuff like that. Those are the things you're going to lose.
So
All right.
some of our patients, they actually lose their bad relationships.
You're going to lose your bad relationships, people who make you feel bad about yourself. All right. You're going to get rid of those people. All right. So you're going to gain better people in your life. You're going to gain better clothes. You're going to gain all these things. But as far as weight, how much are you going to lose? Maybe a couple pounds. All right. But you
Yes.
understand that those couple pounds are not going to change your life. But the liposuction and the improved contour, that will probably change your life and how you feel about yourself and how the world perceives you. So don't worry about what you're going to lose. All right.
Mhm.
You're only going to lose good things. All right. And as
Exactly.
far as the weight goes, you've seen some, I'm sure you've seen some of my patients through Instagram or through a website, whatever. So you'll have a much improved contour. That's what we're going for. That's what we're gaining is a significantly improved contour.
It's only Natasha. Dr. Jeff, thank you so much. 1 week and 1 week post-op and 2 days post-op. Dr. Jeff is the best! Exclamation.
All right.
Signed Natasha Teach.
Oh, thank you so much. So 1 week and 2 days. So she's
Uh-huh.
counting. So she's counting the days. So I can tell you, every couple of days, you're going to look and feel better and better. All right. So she's like 9 days out. You're like, God, I'm glad that you're pleased, but the best is
Mm,
yet to come. So we really expect to see, real results in about 6 weeks and 3 months, and then certainly at about 6 months. And for
it's
you, I can tell you that your feeling post-op is ideal because I have lots of patients who actually look bigger post-op, and why is that? From swelling, right?
yeah.
So from swelling, so we're going to do massages and the garments, the fajas, all of these things to improve the swelling.
Mm-hmm.
Okay, to get to the final result. And I know you have a lot of swelling right now, but the fact that you
Mm,
recognize where you are at 9 days,
mm-hmm.
psychologically, I know you're going to have a great result. So that's the ideal patient for us. And they're
Yes.
and every now and then we see somebody who, they have a life changing result,
Mm.
and they sometimes don't see it, which is really sad, And we show them pre-op photos that are
Yes.
so obvious, So
Yeah.
that's why expectations are really so important. And I spend a lot of time. Sometimes I won't operate on somebody if I feel, that there's not a good fit. That I'm not going, no matter how good the result is, I may not make this patient happy, which is sad because I think that people have to realize that it's the mindset that you approach this with. And it's not necessarily the surgery that's going to change your life. It's the combination of the surgery and your psychology that's going to change your life. You know,
I Yes. Essentially, Candy. I'm going after care on a Jeff doll. She looks great.
wonderful.
Um,
Just send some
what,
pictures and we'll post them.
Doctor, just a story about what you're commenting. I remember one patient of yours, and she was incredibly. It was a change from Earth to the moon. Um, and she was like really, really, she was a BMI really high. And then, she had a tummy tuck. You took a lot of skin. I remember that
Yeah,
case
yeah,
so vividly.
yeah.
And then a couple of months after, you have no idea. She was amazing. I mean, she looked incredible because
Uh
there
huh.
was no, but other doctors, they didn't want to they didn't want to operate on her because she was super big
Complicated. Yeah.
and complicated, sorry. And then when you had that, then she called me a couple of months after. She's like, I think Dr. Jeff missed a spot. I was like,
Right.
what?
Exactly.
And her
Exactly. So
change was incredible.
yeah. So that's a great point, Lily. So with patients, I'm very critical of my own results.
Hmm.
So I'll see, I see patients after surgery, and there are those patients whom I see where I look at, I say, oh, I could have done that a little bit better. I could have done this a little bit better. And I'm always critical. That's what makes me better at what I do. And these patients will look at me and say, oh my God, like, I love it. This is fantastic. I love you, right? This is the best result ever. And then there are the other patients whom I look at and I say, wow, this is just a home run. And I pat myself on the back, and my colleagues might come in and say, wow, you have really done something great here. And the patient will look at me and say, I'm not seeing it. I don't see the result, and,
Yeah.
and things like that. So it's really a malalignment. Clearly, I
Yeah.
favor that first group of patients, that
Hmm.
say, like, who are just realistic, appreciative, and understand that we're not making it a table here. We're doing surgery on real people, real tissue that requires real healing, that requires preventing infection from occurring, that requires all these different things that have to occur to get that beautiful result that you were just talking about with that patient. So it's not just we finish, you don't go into a black box and you come out, like the star machine, if you remember Dr. Zeus and all that, you go in, you have a star when you come out of the machine, it doesn't work that way. It's far more complicated, and to do what I do, I trained for 10 years after I finished med school. So 14 years after college to do what I do. So it's a lot of training, my colleagues as well. We all go through a lot of training to do what we
Yes.
do.
Yeah.
And patients, and ideally most patients come in and say like, they're open-minded, they're looking for a really good result, and they're usually pretty happy. But every so often, it doesn't matter what the situation is, people are just going to have a different impression. And that's why you do the best you can to meet with so that you're on the same page with patients beforehand. And I think that I connect with most people, and I think that I understand people very well. So once in a while, not often, but once in a while, I may come out and say, this is not the best fit. And maybe we could have him see one of my colleagues, or have her see one of my colleagues that might not that they're a better surgeon or not as good of a surgeon, but they may just be a better fit,
Mm.
because you're developing a
Interesting. Yeah.
relationship, right? So we're developing a relationship, right? And everybody has relationships, right? Whether it's your
Yeah.
spouse or your child or your friend, they're all relationships. And a doctor-patient relationship is another type of important relationship, all right? But, sometimes we just end up not on the same page, which is unfortunate. But like the patient you saw that you commented on, like this woman looked unbelievable. And she said, like, I have one little spot. And I'll just say one more thing about that. So sometimes not sometimes I'll see patients after surgery.
She's
They see
coming
them,
back though. She's coming back.
and I will get that spot this time. I will I will
She's
get that spot.
amazing.
That's
Yeah.
amazing. But
Okay.
sometimes it is what it is.
Yeah,
Oh,
it
one,
is
one
what
thing
it
I, one
is.
thing I was one thing I was going to say is sometimes we see patients who have a very nice result 3 months later, and they say, I still think like I'm a little full, like you missed that one spot, right, Lily? And then you look at numbers, say, well, here's the thing, and I'll tell everybody now that my expectation is after these types of body contouring procedures,
Very
not
important.
not, not facelift, not breast, but body contouring. My
Mm-hmm.
expectation is that you lose 10% of body weight.
Mm.
So if you weigh 200 pounds the day of surgery, my hope is that you're going to lose 20 pounds over the next 6 months.
Mm-hmm.
And I'll have the patient that comes in, like Lily is mentioning, you missed the spot of here. I'm a little bit full here. Say, well, I was expecting you to lose, 15 pounds and you gain 10 pounds instead. All
Mm-hmm.
right.
Mm-hmm.
So sometimes that's a real issue, and we'll
Mm-hmm.
analyze the situation, and, we respect people's opinions and say, well, why don't we lose a little bit more weight? And then, or not having gained weight, why don't we lose the weight you gained and a little bit more, and let's take another look at you, when those numbers come down. So we want to be as objective as possible, but very fair also. So I think these conversations really stimulate these kinds of approaches. So I'm ready for your next question, Lily.
I actually have a lot of like another like 10 questions
Sure.
if we want to go like a sprint of
Boom, go for it. Do 11
answer.
then. All right, go. Yeah, yes, no
uh,
questions. Great.
hey, would someone know what size to get for a faja if they were to get the faja somewhere else?
Potentially. I mean, you could ask anyone on our team. Okay, so that's not a problem. We can discuss it with you, right after surgery or even before surgery, anticipating where they will be. That shouldn't be a problem.
I'm so ready with Dr. Jeff, a lot of hearts, March 17, Lipo BBL, Bria Kivinova.
All right, I will be here. I look forward to it. Next.
Crystal Becker, after Lipo 360, chin and arm,
Uh-huh.
how long till I can return to work? I'm a hairstylist.
All right, so the only issue there is the arms. All right, so those will be a little
Mm-hmm.
bit tender. So I would say about a week. All right, so
Mm-hmm.
this is not a huge recovery. You'll be in the faja. You'll be doing massages, hopefully, of each of these areas, including the arms. The arms might
Mm-hmm.
be a little bit tender, but really not a big deal because nothing has really been done to affect the muscle. Say when you do a breast augmentation and the implant goes under the muscle, the pec muscle, which attaches to the humerus, to the long bone of the arm, lifting your arms. I have tons of hairstylist patients, so
Mm-hmm.
that's why I go into
That's
this.
true.
I have lots of patients of mine are hairstylists, so they may take a little bit longer after see a breast augmentation to lift the arms, which is you're constantly lifting your arms
Mm,
when you're doing hairstyling. But if you're just having a liposuction of the arms, not a real issue. I'd say 5 to 7 days, you'll be in good shape.
beautiful. Vivis Burn, is lipo included with an extended tummy tuck?
It's included with every tummy tuck, okay, for
Mm-hmm.
me. So it's always included for the flanks, which we also call the love handle areas, and the upper abdomen. So for me, the standard and the extended tummy tuck will both include liposuction. Good question.
Jessie Chick 226. Do you recommend lipo along with a back lift? Back lift.
It depends on the procedure. If we're going to do a back lift, we're definitely going to be doing liposuction. It's just kind of analogous to the tummy tuck on the front, but we're
Mm,
doing the flanks upper abdomen. If you're going to flip them over and do the back, you're almost certain, if you need a back lift, you almost certainly need, like probably 99.9% of the time,
hmm.
liposuction to the full upper back and the lower back and possibly the lateral chest as well. So that's a great question. But send us your photos so we can determine, in fact, if you actually do need a back lift, like what skin we're trying to remove. Is it lower or is it upper? And that makes a difference in the planning of the procedure. But good question.
Okay. Let me get some of the questions that people. I tried. I'm 5'2", 203 pounds, and getting a tummy tuck with you in March 25th. What is some advice for me? I'm 5'2",
Yep. So her BMI
200
is
pounds.
yeah, BMI is a little over 37. All right.
Mm-hmm.
So that's a BMI. And so my advice is we're going to talk about losing. So it's a little over 200, right? So you'd be
Yeah.
one of the people that would want to lose 15 to 20
Mm-hmm.
pounds after the
Mm-hmm.
procedure.
Yeah.
All right. So over the next 6 months following surgery, my goal is to have you lose 15 to 20 pounds. All right.
Mm-hmm.
Number one. As far as advice, um, basically, maintain your diet, don't gain weight, avoid things that I mentioned before. I'm sure you don't smoke. I'm sure you don't do anything, unusual, or I hope not. I can't be sure. Right.
Mm-hmm.
But if you have more specific questions, I'd be happy to answer those. Postoperatively for the BBLs and tummy tucks, we usually use Lovenox also to prevent clots from forming. So there are a number of things that we do in what we call the perioperative period, the time around the surgery, before and after. So good question.
Is there financing available? The answer is yes. Send us a DM with your name and your phone number. Keep up with Sue, my doctor, and 4 hearts for
Oh,
you,
four
doctor.
hearts. Wow, that's great. It's
Is it
almost as many
normal?
stars. I'll get all these stars for you people.
Is it normal for nipples to look so different after breast with implants? Hello, and she's like covering her face.
Is it different for what to look
Then
different?
if the nipples
For the
look
nipple to
different
look different after a breast lift?
with implants.
Right. So with a breast lift procedure, all of those procedures are done with an incision that goes around the nipple, right? Around the nipple, vertically straight down, and usually horizontally across. Usually it's an anchor incision. So the areola, the nipple is untouched, but the areola is usually reduced with
Mm-hmm.
the breast lift procedure, and then it's going to be lifted with the rest of the
Mm-hmm.
breast. So it will look a little bit different in that it'll be somewhat reduced. But otherwise, they're
Mm-hmm.
usually, round, and they're usually positioned higher on the chest wall.
Okay, thank you, doctor. And Da Bomb Mom 9818. How long should I wait to have a tummy tuck after a hysterectomy?
Hysterectomy. So typically, it depends on the recovery period, but I would say in general, I'd say 3 to 6 months.
Mm-hmm.
Okay, so
Okay.
typically 3 to 6 months following a hysterectomy, typically 6 months following a C-section. Just throw that out there because we're going through the muscles of the uterus in that case, as opposed to a hysterectomy. So I say 3 to 6 months following a hysterectomy.
Any side effects of general anesthesia?
So there can be amnesia. Actually, short-acting
Oh,
amnesia
it's
is
true.
one side effect. We use, Versed often, and that can cause amnesia, so you don't remember any of the procedure. Sometimes we use more of it, sometimes we use less of it. Nausea can be a side effect. We give all of our patients Zofran, which is a very, very
Mm,
strong anti-nausea medication, so everybody gets that. Otherwise, you may feel a little bit lightheaded. You may feel a little bit, kind of sleepy or drowsy for the first 24 hours.
mm-hmm.
And you're going to be on pain medication, so no driving, no making major decisions, that sort of thing. Don't get
Mm.
married within 24 hours after
I
anesthesia,
doctor, now
to
that
the
you
wrong
said that,
person.
now that you
But
said that,
otherwise,
there was a patient one day that she was waking up from anesthesia, and she was like, "I need my phone, I need my phone," and I gave her the phone. I mean, it was like just like I was around there, so I was like, "Oh, give her the phone." I don't remember. I think we were doing social media with her. That was a long time ago. And then she called someone, right? And I thought it was the boyfriend because the boyfriend was paying for the surgery. And she was calling, "I love you, I miss you," and I'm like, "Oh, that's nice. That's your boyfriend?" And she's like, "No, that's my ex."
well, it doesn't always go as planned, right?
And I was like, "Oh, she remember to
So
give
that might
her a
be
phone
that might
after
be
anesthesia."
anesthesia. So that might be anesthesia. Yep, calling the wrong
She was
person or
waking
so,
up.
or yep. So that can be the effective anesthesia as well. right?
Yeah.
Which could be problematic. But in general, again, knock on wood, we have a great anesthesia team. I have not seen a single anesthesia, issue or complication
Oh,
when you work with great anesthesia people. That's what you end up with. Few complications, but side effects, those can occur that we just talked about, and that's normal, and that'll all wear off. Nothing to worry about.
can you hear me? Okay. So, doctor, two more questions. Can you hear me? Hello? Ay, something happened here. I think I lost Dr.
Nope,
Jeff.
here I am. Oh, did you lose me for a second? Oh, I'm sorry.
Okay, so two more questions. How long
Sure.
that okay, let me see. How long does the drainage stays after a tummy tuck? Can I wait? I can wait to see my doctor in March 24th and
Oh,
some
that's great.
hearts.
Oh, that's great. So the drains you're asking about, so those stay for 2 weeks.
Mm-hmm.
All right, so we leave those in for 2 weeks. They remove any fluid that accumulates, any bloody drainage, preventing a hematoma, seroma, things like that. But also that suction holds the flap in place while new blood vessels are growing in those first couple of weeks into the flap. So for me, it's 2 weeks. All
Mm.
right, back to you.
And Unisha has two questions. No, number
Sure.
one, at what BMI do you encourage people to lose weight? And the other one is if she can see some of your work. And the answer is like, Nisha, I don't have the, because it's a double now, I cannot show you right away the screen, but you can go on our description, go to his page, Dr. Jeff Miami Instagram, and then you can see some of his work. And the other one is the BMI. It's all yours, doctor.
You can see hundreds of patients actually of mine. If you go to the Instagram
Yeah,
or to our websites, we've got hundreds of patients there.
yeah.
As far as the BMI, so the cutoff is 38. All right. So if
Mm-hmm.
you can calculate this easily, but if you're over 38, that's when we really want to lose weight for safety reasons and for the best possible outcome afterwards. So I think 38 is the cutoff. If you're above that, we want you to lose weight. If your BMI is anything, we're still going to ask you to try to lose weight after surgery, like 10% of body weight, even if you weigh 140 pounds or 200 pounds, because that's what's going to give us that best result down the road. But initially, if you're above 38, we want to bring that down to below 38.
I guess also the question is like, if what would it be like an ideal BMI to work with to get nice results?
Oh, ideal? Well, it varies. Okay, it really varies. That's a tough question to answer, but probably lower 30s would be
Mm,
closer to ideal. Okay, but I'm not
interesting.
asking, and most patients that come in, they may be a little bit overweight and the BMI may be a little bit higher in the 30s and 32, 34, 35 are not necessarily bad candidates. So you can still
Mm,
have a great result, and we take care of some of the weight loss
mm,
after surgery. All right, but
beautiful.
if the weight loss was going to cause a bad result, I would do all of that before surgery, but that's not usually the case. All right, but ideally, we always want to be closer to ideal body weight. And what is ideal body weight? I guess for a woman, typically for the first 5 feet, it's 100 pounds, and for every additional inch after that, it's 5 more pounds.
And
Okay.
just I am Miss Coco, that she's been asking this question several times. Did he go over the how to avoid blood clots? No,
How
he
to
didn't.
avoid blood
Yeah.
clots. No, we touched upon it briefly, but you got me.
Mhm,
All right. So, how to avoid blood clots. Okay. So, a couple things we do is depending on the case, we might do Lovenox during the procedure and give
mhm,
you a prescription to take Lovenox after the procedure. Okay. And
mhm.
that helps prevent blood clots from forming. So, now you've had surgery and now you're going home or you're in the car or you're on an airplane. So, constant movement, we get you out of bed the next day. Okay. Sometimes the same day we get you out of bed and have you come to the office. So you have to get out of bed to come to the office. So that's one of the reasons we see people the next day so that you can't lay in bed like a slug for a week. We don't want that to happen. If you're on an
That's
airplane,
terrible.
that's
Yeah.
terrible. If you're in a car, you're moving your ankles like you're pushing the gas pedal on a car. Same thing on an airplane. And if you're trying, some patients a week later or so get in the car and their husband or friend drives them home, and some people are 2 hours away and some people are 6 hours away. I would get out of the car every hour, walk around.
Hmm.
I
With
would
your
stand up
compression socks.
with your compression socks and your feet, right, to walk around. And if you're on an airplane, I would get up every hour, plus or minus, and walk up and down the aisle a few times. So movement is very helpful.
The key.
Okay, but we do things during surgery to prevent this from happening. We do compression stockings, which are electronic devices in the OR that squeeze the calf muscle. All right,
Hmm.
and that keeps the blood circulating to prevent clots from forming. Because the reality is that clots typically form during the procedure. All right. So we want to prevent it from happening. So we do a number of things,
Mhm.
before the surgery even starts to prevent
Mhm.
clots from forming. But that's a great question. That's what we do. And these are the things we do after surgery as well. So it's a team effort.
Awesome. Well, thank you, everybody. Thank you, Dr. Jeff, for another
Thank you, Lily.
super great session of
That was a
Ask
super
Dr.
great
Jeff.
session. And I will see
Mhm.
you all next time.
Next Thursday.
All
Bye.
right. Next Thursday. Thanks again, guys. Bye, Lily.
Bye.